Hi, in order to explain why this patient is experiencing a hoarse voice, I'm going to start off by explaining a little bit about the larynx using this 3D model, and the entire structure is larynx. It's also known as the voice box, which is located inside the neck, just below the throat, and at the superior end of the trachea. It is made up of muscles and cartilages, and its primary function is to provide a source of sound for speech by vibrating the vocal folds, seen here, the pink strings. It also protects the airway by preventing food from entering the trachea during swallowing through the glottis, as the glottis closes just like this. Okay, to explain a little bit more about the larynx, we're going to talk about its three main cartilages. The thyroid cartilage is the largest cartilage, and it is often referred to as the Adam's apple. It forms the most anterior and lateral wall of the larynx. It has two sets of horns, the superior and the inferior. The next is the cricoid cartilage. The cricoid cartilage is a ring-shaped cartilage. It provides support for the larynx and is located inferior or below the thyroid cartilage, inferior below, and it is superior, which meaning it is above the trachea. It is narrow in the front, which is the anterior arch, and then it is thicker in the back, known as the cricoid lamina. The third main cartilage is the arytenoids, which are these small pyramid-shaped like cartilages. They're located on the posterior or the back aspect of the cricoid cartilage, and they sit on top the cricoid lamina right here. They're crucial for vocal fold movement. Last but not least are the vocal folds, which are the pink strings. They're positioned superior above the cricoid cartilage, which forms the base of the larynx. They're also located inferior to the thyroid cartilage. The vocal folds are responsible for voice production. So when we speak, the air from our lungs passes through the closed vocal folds, causing them to vibrate. This vibration creates sound, which is then modified by our throat, mouth, and nose to produce speech. Okay, so now I'm going to get into how the vocal folds produce sound through the myoelastic aerodynamic theory. Basically, this starts with the adduction, or the closing of the vocal folds, which is done by the adductor muscles such as the lateral cricoarytenoid and the interarytenoid muscles. They contract to bring the vocal folds together, and they keep the vocal folds in the right position for vibration. This closes the glottis, the space between the vocal folds, and creates a seal in the larynx. As the vocal folds are closed, there is this buildup of air pressure in the lungs beneath the vocal folds, and this pressure is called subglottal pressure. And when it is strong enough, when the subglottal pressure overcomes the resistance of the closed vocal folds, this is called phonation threshold pressure. Once this threshold is reached, the vocal folds are pushed apart, allowing airflow through the glottis. As air flows through the open glottis, it accelerates, and the pressure between the vocal folds decreases. This is known as the Bernoulli effect. The Bernoulli effect and the natural elasticity of the vocal folds, when they reach their maximum displacement, meaning they're the farthest apart, help them to snap back together with the Bernoulli effect and the vocal elasticity. This creates a brief closure, stopping the airflow, and the glottis is once again closed. This cycle is repeated, and the rapid opening and closing of the vocal folds is happening hundreds of times per second, producing vibrations that generate sound. It's also important to note that the abductor muscles, which are the posterior cricoid muscles, pull the vocal folds apart when needed, such as during breathing. And the adductor muscles help bring the vocal folds together and hold them in the right position, the closed position, when they're just like this for vibration. Okay, so why do I think this patient has a hoarse voice? So as stated, she is a saleswoman. She most likely has based on her photo, the photo shown in the assignment, she most likely has vocal fold nodules, which are small benign growths that form on the vocal folds as a result of repetitive stress or overuse, which makes sense in her case because she most likely talks all day as a saleswoman. Nodules prevent the vocal folds from fully coming together, leading to this breathy and hoarse sound as air escapes through the gap, because it's usually supposed to be completely closed. Normally the vocal folds are completely closed to keep just the right position for that vibration during phonation. Okay, so what would I recommend this patient to do? First, I think they need to stay really hydrated. They use their voice a lot. They need to drink a lot of water. They need to minimize substances that are dehydrating, such as caffeine or alcohol, that dry out the vocal folds. And they also may recommend a humidifier. They need a healthy lifestyle and diet. Smoking and getting enough rest and exercise, making sure that your larynx and vocal folds are staying healthy. Also, don't engage in vocally abusive behavior such as yelling, screaming, or long uses without breaks. You should really, as a saleswoman, you're talking a lot. You should really rest your voice when you're sick, and don't overuse your voice because you need to give your vocal folds time to heal. Also, if you may need to be referred to a speech language pathologist to learn healthier voice use techniques. Thank you.